All right. Hi, everyone, and welcome. Thank you for taking the time today to consider our proposal. My name is Jamie Bond.
Victoria Bortner.
Kelly Maddock.
Kimberly McCarthy.
Stacy Peralta.
And we're proposing an improvement on cardiovascular health in our community of Hillsborough County, Florida. So here we have the overview of our presentation for the topics we'll be addressing, and we have time for questions at the end of our presentation. And we also wanted to note that we're in different time zones right now, so we do apologize for any delays or background noises. So let's go ahead and get started. So every 36 seconds, a human life is taken by heart disease. That being said, our focus is on improvement of cardiovascular health and reducing deaths from heart disease and strokes in adults. Heart disease can be defined as a condition where the structural problems of the cardiovascular system are not working together properly. So here we have some of the risk factors for heart disease. We have poor diet and exercise, smoking, and barriers to healthcare in our communities. So the objective we chose is a baseline objective, meaning that there's no record of progress since it's now a point of reference for the next decade. So for Healthy People 2030. And our data comes from the National Health and Nutrition Examination Survey. The way the population is sampled is through the Federal Advisory Committee, and they bring together subject experts. And there also have been improvements that were made after reviewing Healthy People 2020, so our data is a lot more accurate. So the American Heart Association categorized the main heart disease risk factors into 7 goals to improve heart health, which Victoria will be explaining thoroughly in just a moment. And this is how our objective is measured. So currently our nation is at a 3.2, with 3.5 being the target goal and 7 being considered a perfect score. So the focus here is really on preventing heart disease, and that starts with improving health behaviors and having the funds to initiate that. And as public health professionals, we do have to understand that socioeconomic factors play a significant role in heart health. And actually a resident here in Tampa Bay, her name is Camila Edwards. She discovered her life-threatening heart disease a few months after giving birth to her child. And as a Black female, her risk for heart disease was already high, but she credits her doctor, who is also part of the Black community, for understanding her disease. So this is just an example of bridging the gap between patients and socioeconomic barriers, which is an initiative we can also focus on with enough funding. So with that, I'll go ahead and hand it over to Victoria.
So, like she said before, our community of interest is Hillsborough County, Florida. Since there's a lack of data about the specific cardiovascular health score in this community, this slide breaks down each of the 7 criteria Healthy People use to create this score and compares it to a Hillsborough County related risk factor. So ideally, members of our community would meet each of these 7 criteria in order to score a perfect 7 out of 7. However, there has been a negative change in some of these over time. For example, there has been an increase in diabetes mellitus, which is associated with high blood sugar, an increase in physical inactivity, a decrease in the population consuming an adequate amount of fruits and vegetables, and an increase in overweight and obese individuals. However, there has been a positive change in managing blood pressure, controlling cholesterol, and quitting smoking. So why does cardiovascular health score matter? Well, a low score is correlated with heart disease. If we look at the graph on the left, this is age-adjusted deaths from heart disease in Hillsborough County, which is the gray line, compared to Florida, the blue line, from 2001 to 2020. In 2020, there was 165.4 deaths per 100,000 people in Hillsborough County from heart disease. And we can see here that Hillsborough's rates of heart disease have consistently been higher than Florida in general. And although these rates are decreasing, if you look at the graph on the right, heart disease remains the leading cause of death in our community. I'd also like to point out that both diabetes mellitus and hypertension, which are contributors to a low cardiovascular health score, are also listed as leading causes of death. This slide breaks down deaths from heart disease by gender, ethnicity, and race. Per gender, males have consistently had the highest rate. Non-Hispanic individuals have consistently had the highest rate. And then for race, Black and other individuals in 2020 had the highest rate. However, this has been alternating between race over time. So what are possible reasons why heart disease is still the leading cause of death in Hillsborough County? Well, as I alluded to earlier, the prevalence of obesity and diabetes is increasing. Less individuals are engaging in physical activity and eating a healthy diet. And although there has been improvement in blood pressure management, lowering cholesterol levels, and preventing smoking, we do need to see more improvement in additional interventions to continue this trend. And one way we might do this is if every member of the population had a personal doctor. However, only 67% had one in 2019, and 17% of the population could not see a doctor due to cost. And now on to Kimberly.
Thank you, Victoria. National policies and programs have been implemented to lower the risk of cardiovascular disease and improve overall cardiovascular health in adults. The Million Hearts 2027 program is a national initiative co-led by the CDC and the Centers for Medicare and Medicaid Services. The aim of the program is to prevent 1 million or more heart attacks and strokes in the next 5 years by focusing on 3 priority areas. First, building healthy communities through decreasing the use of tobacco and physical inactivity. Second, optimizing care through improving blood pressure control, cholesterol management, and smoking cessation. And third, focusing on health equity by improving access to medical services for pregnant and postpartum women with hypertension, people with lower incomes, racial and ethnic minorities, those with limited access to care, and those with behavioral health issues who use tobacco. The next program I'd like to describe is the Wise Women Program, which stands for Well Integrated Screening and Evaluation for Women Across the Nation. The program serves low-income, uninsured, and underinsured women 40 to 64 years of age and funds 21 state health departments and 3 tribal organizations. The program provides free screening and counseling on the risk factors for cardiovascular disease with an emphasis on improving blood pressure control. This initiative employs evidence-based approaches to achieve its goals. Examples include providing tools and resources for clinicians and pharmacists that enable them to work with patients to improve blood pressure self-monitoring and adherence to blood pressure medications. Other approaches include skill-based training to improve diet and increase physical activity, and referring smokers to tobacco cessation resources. Selected strategies from these very successful programs will be used to improve cardiovascular health among adults in Hillsborough County, Florida. And now I'll turn over to Kelly to describe our proposal.
Thanks, Kim. Now on to our proposal. We will implement strategies from the Million Hearts 2027 initiative to improve cardiovascular health in Hillsborough County by decreasing tobacco use, increasing physical activity, improving blood pressure control, improving cholesterol management. Additionally, we will incorporate the Community Preventative Services Task Force recommendation to reduce out-of-pocket costs for management of cardiovascular disease to improve patient medication compliance, which will decrease the cost of treating cardiovascular disease overall. To achieve the goals set forth by the Million Hearts 2027 initiative, we will offer patient education and counseling both through Hillsborough Department of Health and through healthcare providers identified who would like to participate in the program. We will use free educational materials provided by Million Hearts. Counseling will focus on management strategies, including physical activity support and nutritional guidance. Tobacco use will be decreased through distribution of materials provided in the Million Hearts Tobacco Cessation Change Kit, which also includes intervention guidance for healthcare practitioners. Physical activity will be increased using protocols set forth by the CDC's Healthy Living Everyday program, which has already seen success in Florida. Blood pressure control will be improved by offering free blood pressure monitoring accompanied by education and counseling. Finally, cholesterol management will be improved through offering free cholesterol testing and reduced cost medications for those identified as requiring medication to control their cholesterol. Now on to Stacy for our funding.
And finally, funding. We propose an initial budget of $1.2 million from the Florida Department of Health over a 12-month period. In 2022, Hillsborough County set aside a portion of the $363 million human service allocation for promoting better health behaviors and outcomes. Our goal is to reduce the rate of heart attacks and strokes in the county. If successful, the program will be renewed each year up to 5 years. The funding levels will initially be at a higher cost. The investment will fund program and supporting services, salaries, media, planning meetings, and other expenses. Initially, a greater amount of funding will be spent on research and educating the public and clinicians. As the program continues, the funding for research and education will decrease each year. A greater proportion of the funding in 2026 will be spent on researching outcomes and lessons learned from this program. All other categories of expenditures will be constant. The budget is based on other heart disease prevention programs in Florida. Florida's Governor DeSantis approved the budget for the Florida Department of Health to continue improving the health outcomes of millions of Floridians. Specifically, a portion of the $9 million Strengthening Florida Minority Health and Health Equity Infrastructure budget may be used to address racial and ethnic health disparities. Our county's public health division had a budget of $39.4 million for 2019 and over 35 funding sources. In comparison, public health in Miami-Dade County was $71.3 million and Broward County budget was $48 million. Each of these counties use a significant portion of their budget for community health. The program will establish a collaborative public health and healthcare policy based on program surveys and research. The measurable goal is to lower cases of heart attack and stroke from 312 to less than 300 per 100,000. The program will reduce the individual healthcare costs that favor heart disease prevention. Services may include providing free community blood pressure, BMI, lipid count screening, and smoking cessation clinics. Also, free community-wide physical fitness events will encourage exercise and reduce the incidence of obesity. In conclusion, most health factor rates leading to cardiovascular disease have increased. We will use the federal programs Million Hearts 2027 and Wise Woman as a starting point to improve the county's heart attack and stroke rates. County health and local healthcare providers will carry out the program using the informational resources from the federal program and implement free health clinics and low-cost medication. With your funding approval, we aspire for new opportunities to impact community health through policy, environmental, and behavioral changes, and to make our community as healthy as possible. We appreciate your time and look forward to your review of this program moving forward. Thank you.